when the instruments go back to SPD, that they go back as they come up to the OR so that you can keep them from moving if that's possible. A lot of times microsurgical instrumentation trays, are made such that it is captured by the lid normally. If it has like a silicone bar or something like that that holds the instruments, it doesn't always happen that
way. Clock in, scrub up, and join us behind the red line. You're listening to First Case, a perioperative podcast bringing you exciting interviews, engaging discussions, and innovative solutions that are changing the way patients receive surgical care. Each episode, we talk to frontline staff, perioperative leadership, and nursing entrepreneurs from across the country as they share their stories, experience, and expertise on the industry we love. From the back table to the boardroom, from wheels in to wheels out, we tackle the real-life issues affecting the OR. Whether you're tuning in for surgical service education or inspiration, we're glad you're here. And now it's time to roll back and start the first case.
This week on First Case, we speak with Terry Harrell, Director of Sales at Synovis Micro Companies Alliance. We're going to be talking about micro instruments today, Melanie, and a lot is always talked about as it relates to budget with micro instruments, but also there just always seems to be a little bit of a challenge in making sure that the instruments come back up and they're in good condition. Inspection is critical, and we're going to dive into that, as well as we're also going to be talking about different types of micro instruments and even the materials that they're made of. Very excited to talk with Terry today, and he's got prior experience working in the OR himself, and so it's going to tie the conversation together nicely.
Yeah, this is going to be a very interesting conversation really for me to, I think, to just sit and listen to, because my experience comes from orthopedics, and we didn't use micro instruments very much. And if we did, there was a problem. And usually we were getting in trouble after the case because our micro trays were underneath our total joint trays or underneath something large and heavy, and they were breaking. And so I've heard a lot about what we would do wrong, but my familiarity with the instruments themselves is pretty limited. So I'm looking forward really to learning more about them today. And I know that there's a lot of people that are in the same shoes as me that this conversation will help.
Some great education coming up next with Terry Harrell, Director of Sales at Synovis Micro Companies Alliance, after a short break.
Hi, I'm Paul Wafer.
I'm Melanie Perry.
And I'm Justin Poulin.
A 17 Studios production, you're listening to First Case.
Joining us now is Terry Harrell, Director of Sales at Synovis Micro Companies Alliance. And Terry, we're excited to talk about micro instruments today. And they're kind of their own unique brand per se, where lots of different considerations and sometimes damage even is very hard to identify in micro instruments until the surgeon's using it under a microscope. And so we're going to really put this conversation under a microscope today and get into the small details around micro instruments. Thanks so much for coming on the show.
Well, thanks very much for having me. I appreciate the time with you guys, and I appreciate very much the opportunity to talk about micro instruments. We've been in the field for about 17 years or so selling micro instruments. It is a different area of instrumentation, not very unlike general surgical instrumentation.
So we're definitely going to be talking about the instruments, but before we do, I want you to do something that might come unnatural, which is talk about yourself. Tell us about your background, Terry, and why you've put so much of your professional career into micro instruments.
Well, I'm actually a former OR nurse. I have a degree in nursing from UAB, and I've been in the medical sales world for about 40 years, a little over 40 years now. I use my nursing background every single day of medical, in surgical product sales and medical sales. But I got into this about 25 years ago into the microsurgical world, and we do a lot of reconstructive free flap procedures. Mostly in the U.S., it's mostly breast reconstruction. It's probably probably 60% of our business, and another 30% or so is head and neck cancer reconstruction. And then about 10% is hand and extremity. A lot of that is trauma and that type thing. But that's where you mainly see micro.
And you mentioned that's where you mainly see it in the U.S., but what about globally? Because obviously there's variations, from the U.S. and the global market as well.
Well, in different areas of the world, such as in China, you see a lot more hand surgery because it's such a much more of a manual labor force. In other parts of the world and in the U.S. as well, smoking, any type of tobacco products, alcohol, any type of drugs, that type of thing, leads to head and neck cancers. And head and neck cancers, you always have different types of reconstructive procedures.
So maybe you can tell us a little bit about how you go about getting the staff to destroy all the instruments so we have to replace them all the time in the operating room. It seems to me that seems to be one of the biggest challenges with micro instruments is people not putting them away properly or handling them properly after a case.
Most of the time, micro instruments do not get damaged while they're in use. It normally comes in two phases of sterilization reprocessing, and it's in when the instruments move and when they're cleaned. Normally, the tips of the instruments are so delicate. Usually, they're about a 0.3 millimeter tip on most instruments that you see from a microsurgical instrumentation perspective. And it doesn't take much, if you can imagine getting the tip of an instrument through a cleaning basket or in an ultrasonic cleaner or something like that vibrates against the edge of that tray and can get it bent very, very easily. Dilating forceps are actually even more delicate, and they can become destroyed pretty easily. Actually, we kind of like that because it does, in fact, Paul, as you asked and you stated, it creates a nice aftermarket for product sales.
So what's the best practice in terms of how you treat those instruments to make sure you minimize that damage? I know there's always going to be instances when that occurs, but is there a way to minimize that?
Well, I think the best way to keep instruments from getting damaged is staff training, making sure that everybody knows that's in the SPD and sterile reprocessing that instruments are different. They're not orthopedic instruments. They're not general line instruments. They require a special kind of level of care, unlike other instruments that can be, generally much more delicate in there. When you're cleaning, they need to be cleaned very, very carefully. They need to, always have tip protectors as long as your hospital has validated that you can sterilize with tip protectors. That's probably as good as anything that you can do to protect instrument tips, because it's mostly forceps, dilators, scissors that get damaged the most, and it's mostly forceps. Needle holders are for a micro instrument are fairly rugged comparatively, but it is those, it's the forceps and dilators that you really have to pay close attention to and not damage the tips, because you may not see the damage, I may not see the damage, but when you're under a microscope, the surgeon's going to see the damage, and when that damage is seen under a scope, it's a little bit late in the process.
Mm-hmm. So what can be done in SPD? I mean, is there special materials that you use for cleaning these items? What kind of inspection should they undergo?
If you can just clean with a neutral pH solution, a lot of times instruments are cleaned using an automated cleaner, and that is not always the best case with microsurgical instruments. They're much better if you can clean them by hand. The tips of the instrument should be inspected under magnification if possible. It's sometimes very difficult to do that because of the volume of instruments that comes through an SPD, sterile reprocessing department, that it's almost impossible to do. But we do things like in-service programs and train on instruments and train the staff and SPD on instrumentation, so that if we can reduce the damage of instruments some and prolong the life of a surgical instrument for, maybe it's twice as long. Maybe it's, it could be a half as long, but anything that we can do to prolong the life of the instruments, that's what we try to do. And I was kind of kidding earlier when I told you that we like the reposable type instruments. That's that's not what we're trying to do. We want to extend the life of those instruments as long as we possibly can.
So what about OR staff? What is it that we can do to help extend that life? Or maybe what is it that we're doing that is ruining the lives of those instruments? I mean, specifically, what are we doing wrong, and what can we do better, or how should we be doing it?
I'm not sure that you can pinpoint something that you're doing wrong. I think that you look at making sure that the instruments are as clean as possible. They're free of blood, free of other bodily fluids, that type thing. When you finish with the procedure, if you can wipe the tips, if you can, rinse them in water, not in saline. And I know that a lot of times it's easy to throw in a basin of saline because you've got that on the field. It should be in sterile water, so that you don't have a corrosive element of saline, which for the body, it's normal, but for an instrument, it's not.
Yeah, it's the chloride ions that are in blood and also normal saline that just start to eat away at that protective coating on stainless steel instruments. And that's why you get the pitting, right? And Terry, I've seen that so many times, what you just described. It's just so easy to throw it in a normal saline bath, right? And you think you're doing the right thing, but it's corroding the instrument every second it's in there.
Well, you mentioned a misnomer in stainless steel. First of all, stainless steel will stain and it will rust. Most people think that it won't, but it will. A lot of it depends on, how the instruments are treated, the quality of the water and, that's used in sterilization. There's a myriad of factors in different parts of the world. Water is different, where the water comes from, all that stuff. It goes into the overall life of a surgical instrument. But yes, you're exactly right. Every time that an instrument touches something that it shouldn't, such as saline, that type of thing, it starts a process of damage to the instrument. That's just normal life.
And then, another thing is just how do we transport it? Because sometimes we'll get we'll spend a lot of money on these containers to really secure the instruments, to and from the operating room. And then they don't necessarily go back in as securely as they might arrive. And just banging around inside of a container unsecured can cause bent tips. It can cause the cutting edge of scissors to get damaged or nicked. And as you said, if it doesn't get caught in sterile processing, and it might not, because not every SPD has magnification to inspect, then all of a sudden the surgeon sees it when it's too late, right? And that's the biggest concern.
I would suggest that whatever system that you use to store your instruments in, when the instruments go back to SPD, that they go back as they come up to the OR so that you can keep them from moving if that's possible. A lot of times microsurgical instrumentation trays are made such that it is captured by the lid normally. If it has a like a silicone bar or something like that holds the instruments. Doesn't always happen that way, but in most instances, that can be arranged so that instruments don't move, in a tray when they're being moved from the OR to sterile reprocessing, or during the cleaning and sterilization process, and then back to the OR.
So Terry, I've got a kind of a weird question for you, but I do know that there's more than one grade of stainless steel, and is there a preferred level grade of stainless steel that you use, number one, and number two, I also see where some of the instrumentation is made with titanium. What are the pros and cons of the different kinds of metal that are used in the manufacture of micro instruments? Is one better than the other?
You ask some very interesting questions. Number one, most people use like a 380 grade of stainless. And, stainless steel comes from, depending on what the source of the stainless steel is from, it can have different levels of magnesium in it. It can have different levels of cobalt in it. It can have different levels of iron in it. It's just, sometimes it's kind of all over the board a little bit. What we suggest is, instruments that have, the very finest steel that you can find. And there are a number of brands of surgical instruments out there that are very, very high quality, but use the best steel, and it's not always the least expensive item. It's unlike, it's just like anything else that you do. You get exactly what you pay for. If you buy a $600 pair of scissors or you buy a $200 pair of scissors, I can almost assure you every single time that more expensive scissor or whatever it is going to last you longer. It's going to be a higher quality instrument. Now, titanium instruments are mostly used for suturing. And the reason that titanium can be preferred for that is titanium will not magnetize. Most people will tell you that stainless steel instruments, they magnetize all the time. I would tell you that, can stainless steel instruments magnetize? Absolutely. Probably more often, it's the needle that you're sewing with. And we're using very small suture here and very small needles, anywhere from 8/0 up to 12/0. So, you're talking about very, very small. Sometimes the suture's almost so thin you can't even see it with the naked eye. But the needles are very small, and it's very, very easy to magnetize a needle just through static electricity of packaging, sterilization, everything that the needle goes through. Titanium, however, will not magnetize. And so a lot of times people like titanium to suture with. They use a titanium needle holder, and then the forceps that they grasp the needle with, normally it's a platform forceps, because a platform forceps, in micro instruments, it has a plateau on the inside of the forceps that closes parallel, just like a needle holder does. Platform forceps will, for about 4 millimeters, that's normally the length at which a platform is made, so that you can grasp the needle, and that is just used to sew with. That's sometimes, titanium can be a little bit lighter than stainless steel. Sometimes people say, hand fatigue comes in. Well, I can't tell you that I have a perfect experience of knowing that, X amount of weight or this many ounces or that many ounces causes fatigue. I don't know that. I think it's different for every surgeon that's operating. Some people just prefer the lighter weight. Some people don't like the lighter weight because the surgeon says it feels like I don't have anything in my hand. And so that it's just, again, I think it comes down a lot to surgeon preference. But the pros and cons of titanium mostly is just the anti-magnetic properties of titanium. Titanium is a much harder metal than is stainless steel. It's also a little more brittle. Over time, if you bend, if you damage the tip of a titanium forceps, for instance, the likelihood of getting that straightened back out is much less than with a stainless instrument.
I see. So here's another kind of unusual question for you, but looking at the future of micro instrumentation, is there eventually going to be a little micro robot from Intuitive Surgical that's going to be used with microsurgery instrumentation for these very minute types of procedures that you're doing with this stuff?
Robotics is certainly on the forefront of microsurgery. There's actually a company in the Netherlands, and there's a company also in Italy that are both in robotics. One, the Italian company, actually develops their own instrumentation that can be used with their robot, and the company in the Netherlands actually they can use regular microsurgical instruments that adapt to the robot. But I haven't seen, my experience tells me that, I just haven't seen robotics take off like it has in other, like an Intuitive, like a Da Vinci or something like that people are doing, GYN procedures with, doing prostate procedures, doing cardiac, that type of thing. I just have not seen that as predominant, although I think that is coming, but I think it may be several years before we see it more widely accepted in the market.
So, Terry, we talked a lot about how these instruments go out for reprocessing. And in a lot of cases, that's kind of like magically happening in the background. But we talked about proper transport to help make sure that they don't get damaged. But what kinds of things should be happening to micro instruments when they do go for reprocessing? We just had a cool conversation about titanium. And one thing I know is that titanium instruments shouldn't go in the ultrasonic cleaner with regular stainless steel instruments. So that's kind of one of those nuances to micro instruments. And you talked about how brittle they are. And, I know they can crack. And so inspection, especially of those titanium, but really all micro instruments, is really critical when they go out for reprocessing. Can you think of anything maybe either more granular on what I was just saying or other considerations, especially for leadership in the OR that might have oversight over SPD? Because this is so unique. And when you even think about eye instruments as one category of micro instruments, there's been a total shying away in the instructions for use from manufacturers from using enzymatics as a result of the TAS outbreaks many years ago.
Well, I think one of the things that we see in inspecting surgical instruments, especially any type of hinged instrument, and that can be scissors and or needle holders. And needle holders are probably the instrument that gets damaged the most, and it's normally from grasping something too large that the needle holder was designed to hold. If you put, say, a 3 or a 4.0 needle in a micro needle holder, it's the force that you exert on the box lock of that instrument is just so tremendous, and the weak point in that is where the hinge and the pin that can always crack. If that cracks, it cannot be repaired. You might as well take it and throw it away. That needs to be inspected every time. Same thing for scissors as well, but it's mostly that's what you would see in a hinged type instrument. You might sometimes you see double hinged instruments, and especially needle holders, and that's just made for the surgeon, that he doesn't have to move his or her fingers as far, to grasp a needle. Most of the time you see a needle holder in micro does not have a lock on it. Every place else that you use a needle holder has a locking mechanism, be it cardiac or with a spring handle instrument, just like what you would use in micro, or it's very, very odd in the U.S. market for any of the, other than doing lymphatic surgery. That's where people do like a lock, because the needles are so small If you're using an 11-0 or 12-0, the needle is just so small, it's almost impossible to see the needle and without magnification, and needs to have a lock there. But we see that a lot. And then just in inspecting instruments and looking at tips, if you can look at a tip of instruments, if it doesn't look right, if it's got a burr on it, if one side is a little bit out of alignment, when it's under a scope, that defect is only exaggerated. That's when you get an angry surgeon, and who's ever scrubbed with the surgeon normally isn't very happy.
You mentioned the micro scissors, and just a question about the scissors. How frequently do they have to be sharpened, and how difficult is that to do since they're so small? Do they get dull after a while?
Well, normally micro scissors are used more as a dissection and a dissecting instrument. They're used like your fingers to spread tissue with instrument tips, and you use the blades to do that. About the only thing that you really, you might cut some tissue, you might cut a nerve, a tendon, a blood vessel, something like that with a micro scissor. But there's two types of scissors you normally see. One is a curved scissor, which is a dissecting scissor. It has the tips are a little more blunt. They're curved so that you can see the tip very well under the scope, because you have to understand that the surgeon's normally looking at a two-dimensional image under a microscope, and it's a little bit different, and you normally use that dissecting scissor to go down beside a structure and use it just to spread the tissue out. Then you have a straight scissor. It's called an adventitious scissor. It has a little finer blade. It's a little sharper point, and it's normally used for fine trimming around any type of delicate structure around a vessel edge. If you're cutting off adventitia around the end of a vessel, cleaning up that before you suture or couple it or whatever, however you anastomose that vessel. One of the things that you do see with scissors, and I'm getting around to answering your question, you say, how often do you have to sharpen them? When you cut suture with a scissor, anytime you cut a very hard material with a scissor, you can damage that scissor edge. Scissors come, there's different types. You can have a serrated blade, for a nerve or a tendon, so that one blade of the scissor actually holds the tissue and the other blade shears it off. But if you're cutting something like suture, can you damage scissor? Yeah, you can. Myself, I would send that back to somebody who, if a scissor gets dull and it needs to be resharpened, I would send it back to somebody who knows what they're doing with microsurgical instrumentation. I would not send it to somebody who just, that pulls up behind the hospital. That's my personal preference. They may do great with macro instruments, but for micro, I think you need to have somebody who is a very specialized and knows that area very, very well.
And you talked about the scissor that grabs the tissue and holds it. And what's interesting, and a very common one would be the Stili, but you have that serrated edge, and those serrated edges do exactly what you said, almost like a guillotine. They grab the tissue, they hold it in place, and then you actually have a knife edge coming through, which is why they're considered to be so sharp. That knife edge comes through and that tissue's held in place, and it cuts it very clean. And when you talk about general scissors, they're actually edged on both sides. Both blades are edged, so it's a completely different design. And being able to, as you said, repair those serrations, takes some skill and special tools. And then that knife edge as well, the last thing you want to have on a scissor is a burr, because that will absolutely rip and tear tissue. And when you're doing microsurgery, that's going to cause scarring and all kinds of other post-operative complications.
You mentioned, scissors are actually, are they a cutting instrument? And they certainly can be. But a scissor, any type of scissors, acts as a shear, so that one blade holds the tissue. The other blade is actually where you get your cutting action from. It's not like two sharp surfaces coming together or a knife. It's more, you have to, you can a lot of times you can tell a dull scissor because it tends to push the tissue out of the scissor. And that means that the blade that is holding the tissue is not holding, it's pushing, it's letting the tissue slide.
Mm-hmm. Yeah, it's almost like pushing it right out of the blades instead of, yeah. All right. Well, Terry, this was a great interview with a lot of detail. I almost feel like we got a real inside look on instrument manufacturing in a way, and the functionality and how it works. You obviously spent time in the operating room. You obviously spent a lot of time with micro instruments, and this was a really good job. Is there anything you want to add before we wrap up?
Well, only thing I would add is just, again, instruments, people, if you want to get a bargain, buy the best quality that you can. It'll make the SPD person, it'll make that person's life more simple. The operating room staff, be it a circulating nurse, a scrub nurse, it'll make their life simpler, and it'll make your surgeon happy. And if you've got a happy surgeon, I think that's what we all would prefer to have.
Amen. Terry, thanks so much for coming on the show today.
Well, thank you very much for having me. I appreciate it very much.
That was Terry Harrell, Director of Sales at Synovis Micro Companies Alliance. We're talking about micro instruments. Paul, you asked some really good questions, but the one that really stuck out to me, that caught me by surprise, and I know it just kind of popped into your head in the middle of the interview, was how long before we see robotic procedures being done at the microscopic or micro instrument level. And he had a much more, maybe that future isn't so far off in the distance kind of an answer, which I did not anticipate. So a lot of detail in this interview. And that's because micro instruments really are very detail oriented if you want to be successful and have safe procedures.
Yeah, I was really surprised at what kind of things you have to be really careful about with these instruments. I mean, I know from my OR director days, having to pay to get them replaced was always a big issue, and physicians being very upset when they weren't perfect in the operating room. So, I mean, it is a very important issue that I think the OR staff and SPD staff need to keep in mind when they're carrying and handling for these instruments. And he did a real good job of explaining why it's so important. So I'm really glad we were able to have Terry on the show.
Yeah. Budget, absolutely one of the biggest concerns and conversations, but inspection, so critical. And, honestly, if you have any relationship with the sterile processing department at your facilities, if they don't have magnification to inspect micro instruments with, it should be one of the first recommendations you make. Not a big investment in terms of budget to get that magnification, but definitely, as you said, Paul, a big impact to the budget if the instruments are damaged and not repaired in time, and then they wind up having to be fully replaced. So that's going to do it for this week's show. As a reminder, you can help support First Case by subscribing on Apple, Amazon, or Google Podcasts. You can also find us on Stitcher, iHeartRadio, Spotify, or just search for the First Case podcast on your favorite application. You can also access bonus content for certain episodes by downloading our smartphone app for iPhone or Android. And while you're there, we'd certainly appreciate a rating and a review because your feedback is important to the show. On behalf of Paul, Melanie, and myself, thank you for listening to this week's episode of First Case.